Okay, good morning, everybody. So we are taking the second topic. We are treating the reoccurrence of miscarriage. But first of all, we understand what miscarriage is, and then the possible cause of miscarriages, and then we'll be able to find out ways to address it. So now we'll be talking about miscarriage. What is miscarriage? Miscarriage is the loss of pregnancy at the on or before 20 weeks. It's actually a relative common occurrence among 20% of known pregnancy. Miscarriage can also be caused by so many factors, including chromosomal abnormalities. This is genetic errors in the embryo, all right, hormonal imbalance issues which could actually be produced as a result of pregnancy. Okay, as we've talked about the chromosomal abnormality, which is a genetic error in the embryo of the fetus you're carrying, can actually be a basic factor or particular factor that will actually induce miscarriage. Okay, amongst it is hormonal imbalance. But hormonal imbalance on its own is another factor that can actually lead to miscarriage. Do you get it? It can actually lead to miscarriage because the hormone production there could actually, during the pregnancy, could actually have some deficiency. Okay, so once there's deficiency in any hormones, it can actually lead to the same miscarriage. So understand it. Among the factors, uterine abnormalities. When we talk about uterine abnormalities, it's a problem with the shape and structure of the uterus. It can actually be another factor that can actually lead to miscarriage. So when we talk about it, we have another basic factor, which is no other thing but infection. Bacterial or viral infection can actually affect pregnancy at every given point. Basically, at that point, we talk about 20 weeks, which affect about 20% of women that are pregnant. Okay, understand that infection is a root factor, especially Candida and Staph and E. coli. Others UTI can actually cause so much in the pregnant woman that can actually lead to miscarriage. So understand that before you actually take in for any reason, you have to clear yourself of infection. With that, it will enable the terms or the journey of pregnancy to be so smooth. Thank you so much. Okay, we'll talk about the next factor, which is the lifestyle factor. Lifestyle factor can actually enhance miscarriage. It can actually induce miscarriage so well. When I talk about lifestyle factor, it has to do with smoking. It has to do with your alcohol consumption. It has to do with so many things. Many people who dance so much with pregnancy, people who do strenuous exercises or do strenuous businesses that actually affect them, people who jump, people who do a lot of things that actually is not too good for a healthy woman who has a life in her. It can actually induce miscarriage. It can actually induce bleeding and then lead to miscarriage. Okay, so when we are now to talk about the reoccurrence of this, the occurrence of miscarriage is known as recurrent pregnant loss, and this is referred to 3 or more consecutive pregnancy before the 20th week. Okay, it affects about 1% of couples trying to conceive or trying to clear their fertility issues. Okay, causes of those recurrent is what we've actually said, which is genetic factor. Genetic factor, which is the chromosomal abnormalities, when the genetic mutations or the genetic factors or the genes that are meant to be in place during the conception, during fertilization, failed or are not enough, are not intact. So this can be what lead, because the formation of that fetus is not okay. It can actually induce bleeding and then lead to miscarriage thereafter, and there will be a loss of that same baby. Okay, amongst it is still this infection I've made mention of. Understand it. I've made mention of uterine abnormality, which has to do with the shape and structure of the uterus. You have to do your pelvic scan very well to make sure, ascertain that everything is doing well before taking in. Okay, hormonal imbalance I've made mention. This is when there is reduction in the hormones that are that are supposed to take care of the journey of pregnancy is not enough. Maybe the production, the uterus and ovaries are not, the ovaries are not producing the hormones that is meant to be. Understand it well, and then all the issues or factors that lead to miscarriage will stop. Thank you, as I believe you've understood, and you're following me the first time. Make sure you subscribe, follow us in our Facebook channel, then make sure you subscribe to our YouTube channel, CC Natural Therapy. Thank you, as we're making you take in charge of your health.